Welcome, Anca, and thank you so much for taking part in our second season of Brave Talks. And today I'm very excited because this is one of the topics that normally our clients and potential clients always says it's not possible to measure the impact of any kind of health interventions within the occupational setting. But I know that you're going to showcase exactly what can be done and how can these organizations really measure the outcomes. But first and foremost, could you talk a little bit about yourself, present yourself, the work you've been doing, where you're based also, so for our community to get to know you?
Thank you. Thank you very much, Liliana, for inviting me. It's a pleasure to be here with you and to answer your questions and to virtually meet your community. So I am Anca Coriiu. I'm an expert in calculating the return on investment of prevention care programs, be it occupational health, mental health, physical health programs, but also coaching programs and leadership programs. So I basically explain what is the outcome in money terms for investing in health.
Mm-hmm. And you're based in Switzerland, right? And you have 3 kids.
So I'm based in Geneva, indeed, in Switzerland for the past 15 years. I'm Romanian by origin. I have 3 teenagers. I enjoyed these, challenges as well. And I'm growing with them.
Okay, of course. As you know, Geneva is a very special city for me. I also did my Erasmus in Geneva many, many years ago. And so I have great memories of living in the city and studying there at University of Geneva. Okay, so one of the things
If I can,
yes,
I'd like to add about Geneva. I think Geneva is home to more than 150 organizations that are supporting health, right? And NGOs, I think, is the best place to be when we start measuring the impact of health.
Mm-hmm. Yeah, whether it's a global scale, whether it's a local, national, or even within an organization, right? So I think, yeah. And from the beginning, I think your background is in economics, right, Anca? So
Yes, so I did international business in Romania, and then I traveled to France and I entered the international program. So Master of Arts in macroeconomics for European politics of integration. Then I joined the corporate world for 15 years. I was working with American global companies and with Japanese global companies. And in 2016, I started a new life. And I'm an entrepreneur, so I'm a consultant. I started working as a consultant for employee assistance programming industry. And I was representing TELUS Health, that was back then named LifeWorks, in Switzerland and in Europe. And for 1.5 years now, I work strictly on this niche that is the calculation of the ROI for prevention care programs.
Yes. And we've met, of course, in EAF conferences, not to
Yes.
not to avoid to disclose how we met and BEAM meeting, because I think I remember that we've been to more than 2 conferences already, Anca, where I met.
Yes, we've met in Athens first, and
yes,
then in Luxembourg. Yeah,
exactly. Okay, so one of the things that I hear the most when I talk to clients or potential clients is that this field of promoting health in organization is something very subjective. So it's very hard to make it tangible in economic terms and to really present these arguments to the top management who makes the decision, whether it's a CFO, whether it's, any kind of top manager that actually pulls the shots and decides. But tell me, Anca, can actually health and well-being have concrete metrics in organizational setting, economic metrics, but not only economics, but is it possible to really measure health and well-being within the occupational setting, and particularly the preventing approach programs that you actually implement?
yes, of course it's possible.
How
we can measure everything. We just need the will to measure. And the preventive care is usually the most cost-efficient manner to deal with issues that health create at work. namely absenteeism, presenteeism, turnover, accidents, disability. So yes, we should invest in prevention care, and definitely we should measure this investment, because otherwise it may look, like you say, subjective. So if you have some spare money, would you put a bit in it? But then the moment where you need to make priority calls, if you don't have it as an investment on the investment list so that you can compare with investing in machinery, with investing in new real estate, you cannot support this investment anymore. You would consider it, charity
A
that you cut.
cost. A cost that you cut, even if you shouldn't cut. But do you think that this change in perception that this is an investment is starting to happen particularly after COVID? No, not yet. Not yet. So as an economist, you are here to tell the truth.
So let's say it depends on the geography, right? And when you travel the world, it's like traveling time. And we are so different. There are countries like the States where investing in prevention and is an investment. And the state, they always have this tradition of measuring all types of investment, right? So it's culturally first, but also because the companies they are self-insured. So they basically pay for the medication and for the doctor visits of the employees. Therefore, they are much more sensitive to the medical costs besides the productivity costs. So in the States, I would say, yes, there is more measurement of prevention care programs than outside of the States. In Europe, this is a bit new, also because our insurers, traditionally, they are very good at calculating medical costs, but they are less good in calculating prevention care and very not yet there in calculating prevention care for mental health. So because the insurers don't have this capability developed yet, and it's really new to invest in mental health at work in Europe, it's mostly coming since COVID, yeah, we don't measure much. I mean, there are some companies that start measuring, but not many.
Not, yes. And at the same time, and of course, as a psychology, we always propose measurements that are much more focused on any kind of clinical or social indicator. But of course, from the financial perspective, you really need to make it tangible also in terms of return on investment. What sometimes I think is that we have a lot of studies, particularly in the United States, and particularly within the employee assistance sector, that you have this clear idea, more than tested, more than validated, that for each euro that you invest in this type of programs, you get a clear return on your investment. But still, when you say this in Europe, they don't believe you. So it's like there's a huge amount of evidence, right? And there's ways to calculate, there's ways to adjust the calculation per country, per sector, per whatever. But still, people consider this to be subjective. And I wonder why. Why in Europe, and I think in Europe, it's the biggest challenge, are we not so believing in the data that we already have and believing in professionals that are doing these calculations and assessing impact of programs?
It's very interesting. My experience is a bit different. Huh? I have personally reviewed over 1,000 European studies of dealing with the impact of different health conditions, common mental health illnesses, but also physical health, on the productivity, so absenteeism, presenteeism, indirect costs, and also on direct medical costs. So Europe has huge capability and a lot of studies, libraries. I only selected 400 because of comparability of data. It's difficult to compare, to keep the data comparable between European countries because we didn't integrate fully there. But still, we have in Europe already a lot of very good studies, and Nordic countries are even more advanced. But definitely, I found really very good studies for Portugal, for Spain, France, Poland, Switzerland. So Italy a bit less I found, but maybe because I didn't read in Italian. So I would say the data is there. Now, what is the difficulty? The difficulty is measuring the return on investment. Is what I do is Wellcast ROI for prevention care programs requires knowledge of different kind of industries. Yeah, so it's about health economics, it's about epidemiology, and it's about finance, so that you can turn the reduction of incidence of those conditions and the reduction of risks into money terms for each payer. And the payer can be the individual that needs to pay medication, visits, and so on, or the corporation that needs to pay for the fact that their employee is absent or distracted or is leaving the company, and the insurer that needs to pay the claims. Yeah, with disability, with accidents, the medical costs as well. So not measuring is coming from the fact that this capability is niche. So it's not yet developed, and this is why we found a place to develop Wellcast ROI.
Of course, of course. And can you explain a little bit how you do it with your clients? And we are also partners with you, but we want to understand a little bit how then you set up this evaluation of return on investment on health programs. And particularly, we've been discussing a lot of preventing health programs, but to describe the process, how you work with your clients.
Well, I would give an example. So let's say we have a Portuguese company that would like to implement a mental health support program. Let's say an employee assistance program, right? Like the program that can cover most type of common, issues, be it emotional issues, financial advice, legal advice. So let's say they would have 100 employees, this Portuguese company, and they would, pay 500 euros per month for having such a program. I'm inventing the price, obviously. Right? This would mean a cost of 6,000 euros per year. Now, the question is, how many employees would have such a VAP-related issues? And maybe within Portugal, we would know how to calculate the prevalence of VAP-related issues would be 20-30%. Yeah, so let's say between 20 and 30 employees in 1 year would have VAP-related issues and could benefit from this support, but only 5 of them would call the AP for different reasons. Some they don't know it exists, or they are too stressed and they forgot they have this support, or they don't believe they can be helped, or there is a cultural, stigma associated with asking for help. So 5 of them would call and would actually benefit from the support offered by the employee assistance program. Then for the employer, the question is, would the savings brought by these 5 employees that I have supported are justifying me paying 6,000 euros during 1 year for EAP? And the answer is, it depends. Most of the times, and this is based on calculation of thousands of employee assistance program return on investment for different companies in different countries, in different industries. Most of the time, employee assistance program has positive return on investment. However, it's coming only if it's enough engagement and if the price is correct, right? So in order to understand if it's correct, we have designed a calculator to make it easy for everyone to run a almost instant calculation of its prevention program return on investment, in this case, EAP. So how we go about it, we are asking what is the country of the organization and what is the industry where this organization is operating. Because different industries, they have different productivity. So if you compare a manufacturer with a finance consultant, the output of their employees in money terms is different. It's higher for a consultant than for a manufacturer. Therefore, the savings they can have from an employee assistance programs, they are higher for a consultant than for a manufacturer. Then for the same engagement, you need to understand if the price is, possible to be paid by the manufacturer, the same price as the price that would be paid by the consultants company. Yeah. So first we are establishing actually what is the average productivity of the employees. And we do have a modality to calculate it based on the salary and the location and the industry of the employer. Then we move and we are looking at the economic assumptions. So we would know for that respective employer, if it's different from the average of the country, what is its relocation rate? What is its absenteeism, its presenteeism rates? And therefore, we would be able to understand what are the costs that are having this employee. Then we would look into the program. And we know the employee assistance programs, they are pretty good at measuring the efficiency they have in diminishing certain conditions. Therefore, considering the efficiency of the program in reducing absenteeism, presenteeism, turnover, we would understand what are the savings for that employer. So we can offer not only what is the net present value for investing in the program, the benefit to cost ratio, and the internal rate of return, but also the break-even metrics. What is the maximum price they should pay for that EAP? And what is the minimum utilization they should have so that the program would have a positive ROI?
Yeah, that's so interesting. And at the same time, so clear before they make the investment, but also to correct the current investments. Like sometimes they are just paying for specific health benefits or health-related programs, but then they cannot know if they should continue or not. They don't have enough data to support the decisions to continue or to refine that investment or to improve the metrics of engagement, for instance, or what can we do to actually boost the value of these programs. And this is so interesting because at least from the companies that I've been in the past 20 years almost working with, I don't see this sensibility, right? I don't see this capacity to really, okay, let's measure this. Let's have some kind of health economics metrics that could actually support, and then we can go to top management and ask for a bigger investment in terms of, even if it's, and you referred a lot of employee programs, but I would say for all kinds of diseases or health challenges that the organization is facing, right? So you do this also for other type of programs, not just employee assistance programs. So what's your experience on that? How do you see them? Do they, for the physical health, have better metrics or?
Well, I wouldn't say, I wouldn't ask the question this way. If I can, I would rephrase the question. I would say, sorry, for a break, to gather my thoughts. It is difficult for HR or for benefits or health benefits responsible, or for people and culture department, because these programs, they can stay in different places in the company, to calculate the return on investment, okay? It's not that there is no will, it's because it's difficult. This is why we decided to make it simpler and offer a calculator. And the data exists for the same for occupational health, for medical health, physical health, sorry, and for mental health. But as well, we can use the same methodology of calculation for coaching programs, for digital health platforms, right? Like a meditation kind of platform, or for leadership programs that have an impact on the psychological health and safety of the entire organization. Yeah, so the same logic would apply for all types of programs. For physical programs, it's not easier or harder to define the return on investment. You just follow the same logic. Let's say for physical program, you would have a fitness program. And offering a fitness program may be a good or a bad choice, depending on what are the costs that your company will incur from the different conditions your population will have. But let's say you offer this physical program, not to the young and healthy and fit that anyway would go to gym, but to the people that are, have passed 35 and they start having higher risk of coronary heart disease, prediabetes, musculoskeletal problems, and all other conditions linked with that. And this physical health program can be, weightlifting. It can also be yoga classes, cardio. So depending on how the program is designed, it will have an impact on certain conditions and diminishing their incidence. So therefore, it will have a certain impact on diminishing the absenteeism, the presenteeism, and the risk of turnover of the employees that are taking the program. It's the same logic.
Mm-hmm. So there's no difference. So perhaps my question is so already linked with this difference in terms of I think when we talk, it seems like mental health is something much more subjective than doesn't have the same methodology, but it has the exact same methodology as other health conditions, and it can of course be prevented, and the costs can be reverted and savings met. Yeah.
The question I wanted to rephrase, it
Yeah.
was, what are the right programs? So we have occupational health, we have mental health, we have physical health. As in one organization, what should we offer? This is the question that everyone should ask from an organization level. And then the answer will depend on the structure of the population. Based on our epidemiological databases and the data available publicly, okay, if you have a population that is more skewed to younger or women or men, you'd have different prevalence of conditions. So you need to rank for each organization. This is what our calculator does. What is the incidence of those conditions within their population? And if you compare an IT company that has usually quite young, programmers with a factory that has different kind of departments and so on, the structure of the population is obviously different. So therefore, the programs they should implement are different. I have a client that has offices, global offices, and also production sites. And the programs they should implement in the office versus the production site are different because the population structure is different. Therefore, the conditions that they will get are different. And when you look at the prevalence of those conditions, you may find out that 25% of your employees risk to have a flu within 1 year, right? But the losses, the productivity losses that you care most about, that are associated with that condition, there may be 5% of all your losses. While if only 8% of your population that are the most experienced employees, older, higher positions, and very high productivity, suffer from coronary heart disease, this would be 25% of your costs. So therefore, you need to choose your program with a bit of help so that you understand which types of conditions you are going to tackle. And then there are different programs that can tackle one or more conditions.
Of course.
Right? And you should be able to compare those programs also based on the return.
But do you think companies are already doing this, or they tend to rely on partners to make this decision for them? What's your most? Yeah.
So there are companies that I work with that they have medical doctors, occupational health doctors and nurses that are better at ranking the prevalence of diseases than other companies, right? Because they have this internal capability. However, they cannot measure by themselves the impact of those conditions, as I was giving the example with the flu and the coronary heart disease. So therefore, knowing if they should implement a smoking cessation program or a resilience coaching program or an ergonomic chair kind of program, in order to calculate what is the impact of all those conditions, they would need our help to understand the productivity losses from each of those conditions. And therefore, they would know what type of program they should implement first, second, third, depending on the budget and the return of each program. Then there are companies that are going for trends. So if it's trendy to offer yoga classes, we are just going to offer yoga classes to everyone, right? And those companies, they are quite innovative. They tend to have higher, younger population in those departments, and this very well. But then the return of those programs is definitely limited.
Yes, true. So it's also, as you say, really identify what is the prevalence, what are the key priorities that you need that will guarantee better returns, right? So you can choose many things, right? But there are, for your population in this country, in this sector, with this rate in terms of productivity, you need to calculate, and you need to partner with a company such as Wellcast ROI to be able to do that. Because I haven't seen these capabilities in-house, whether they have a team dedicated to health, I haven't seen. And some of them do rely perhaps in a benefits partner, such as a broker, but actually the broker is much more focused on selling the products that they want to sell. So there might be some conflict of interest there. I don't know. I'm not sure.
First, I'd like to thank you for phrasing, it's really about calculating for every kind of organization and for every kind of program the return. It's really the main conclusion. No? So you cannot give numbers that are true for everyone because everyone is different. Then secondly, in terms of capabilities of calculation, normally the return on investment sits with the CFO. But the CFO will definitely want to hide under the table when HR people come to see him for this kind of investments, because they are missing epidemiological data and they are missing efficiency of programs data, right? So no, they cannot really do it well in-house. They would need to outsource to someone that really does this as a job, like Wellcast ROI. Then for the insurers are quite good with their actuaries in calculating medical costs, but they do not have the productivity databases to be able to explain what are the savings on the employer side. The programs they are offering, there is no conflict of interest. They are serving everyone. The health of the employee, the productivity of the employer, and the diminishing of costs of the insurer. They are serving everyone. But how much is the question? So this is what every time we need to calculate.
Yeah, okay. So you don't see a conflict of interest. I understand.
No.
But at the same time, are you investing in the best form possible to guarantee the best results, not just financial, but also in terms of people results, right? For people to really be able to thrive in your organization. And that is the main question. I do see a change, so I'm quite optimistic about the future, Anca. But as a psychologist, I have to tell there's big resistance to this effective metric approach to really assess all the health promotion interventions that you do in your organization, or health interventions. There's some resistance there, but things are changing. Things are, they are more open now. I don't know if you have the same optimistic lens.
Yes, it did. Things are changing, and it's new also. We need to understand that Wellcast ROI has a history of 30 years. It started in the States, but it's fairly new to Europe. So it's for 1 year and a half in Europe only. And I had the immense chance to co-develop the European product with Lu Servizio, who is an institution in ROI calculation for prevention care programs. So it's new. Obviously, as everything that is new, it will take time to establish. And also we need to understand at the same time that Europe is old, okay? So you're bringing something new to someone old, it will take time, but it's coming.
Time. It is coming. It is inevitable, I would say. And also within this new, the new sustainability reporting directive, then you need to tangibly and with traceable data show that you are doing the best decisions in terms of the health and well-being of your employees. This will change a bit. I'm quite confident that this is the final push, I would say.
Thank you for mentioning. It's my dream. Imagine you are investing as an employer in 3 programs, okay? One for physical health, one for mental health, and anything else, okay? And those programs, they have a return on investment, and you finally calculate it. So in your annual report, not only you can put what percentage of your output is coming from investing in health, but also under the S letter, you can show how much out of pocket you have saved to your employees because they didn't have to search for those services outside of the company and pay them out of their pocket? And how much did you save for the society because you have diminished the medical costs? So this for me is the ideal world.
Yes, it is. Well, it will take time. We are sure about it because there's a lot of voices that are not so confident about it. But I think it will help, and particularly in the field of mental health and everything related to occupational psychology, that it finally we have the data, we have the instruments, we can combine it with other economic metrics that are there. It's the same methodology for all kinds of prevalences or health problems within the organizational setting. And finally, they need to report it annually. So they really need to showcase that it's not just ticking the box, it's then presenting the results, right? Time over time. So imagine you can have a bad year, but you cannot have 10 bad years, right? This means your health investment strategy might need to be replaced because it's not delivering the best results. Yeah. So there's a big change coming there. So a final question, Anca, and this is more personal.
Please.
So how do you see yourself working in 2030? Will you be leading Wellcast ROI in Europe still? Will you be working as you are working now and with this type of clients and partners? How do you see yourself working in 2030?
Thank you for this question. I think definitely I see myself with Wellcast ROI, growing this business. It's a niche, but it's needed by everyone. And I see myself working much more with artificial intelligence, which is our new layer to democratize this information for everyone that would like to measure what they invest in health and what is the outcome of what they invest in health. And I see myself in Geneva, and I see myself working not only with corporations and health insurers and health plans, but also with public health, because there is a big need there as well to measure prevention so that we can invest more in prevention.
Yeah, it's a wide question, right? It's a national government level question. It's a global question. So in Geneva, again, it's the right place to be, right? For the ones
everywhere is the right place to be for prevention. And yes, you're right, global first, but also at country level, at city level, at organization level, and at private level. We should measure what is the outcome we are getting from preventing, living healthy lives and preventing issues.
True. And get rewards for that also.
Well, the reward is health.
Yes, it's true. So thank you so much, Anca, for being with us. And it was an amazing conversation, as always. And I think it's a good introduction to the theme. We have to continue our conversations. And thank you also for your partnership. And let's bring this to all organizations, to all city councils and public bodies, right? Because they also have a game to play in order to really increase preventive care in a way that it's never been done before. I don't know any country that actually does it perfectly yet, but we are on our track, right? We are on our track to do it right. And with the help of a more financial, economic perspective, this will help to sustain the investment needed to get the results we want. Thank you so much.
Thank you very much. Thank you for the opportunity of presenting this tool. And it's a pleasure. So looking forward to next year.